needed. Well, let's talk to Dr. Adrian Boyle, who's president of the Royal College of Emergency Medicine. Good morning.
Morning.
And let's get a sense of what's happening in terms of the picture around England. Is this unusual, would you say?
Absolutely not. So this will be happening pretty much around almost every emergency department around the UK at the moment. The situation is really dire. We know that everyone is focused on ambulance offloads because that's the most visible manifestation. But we have to look at this as a system. And what we're seeing is the ambulances are stacking up because the emergency departments are full, because in turn the hospitals are full. We've just recorded in October, and NHS England published this on Wednesday, the worst ever performance figures against the 4-hour target, the amount of time somebody spent in an emergency department. And we also know right down, going all the way through to the back door, there's 13,000 people in hospital, over 10% of the bed base, who can't be discharged back home. They're stuck in hospital and just using a bed that actually, in a way, isn't good for them.
So the patients waiting outside, they are with paramedics, aren't they, as they're waiting? Are there risks for them?
Yes, there are definitely risks. Yes, they are being looked after by a patient, but you need to think about the second victim, and that in that case, that's the patient who is waiting for a response. So we are regularly hearing about lots and lots of people stuck on the floor for a long time. People can't get them up, and they're waiting and waiting for an ambulance. When people phone for an ambulance, they are in an enormous state of anxiety and panic, and the stress of a really long wait for an ambulance is unimaginable. It's appalling. So it's not just the person in the ambulance, it's the delayed response to the next ambulance call.
Now, the NHS England is saying, they acknowledge that October's been a very challenging month because of what they call the triple-demic COVID, flu and record pressures, but they are saying that they've set a target to eliminate all waits of more than a year. This is general for hospital treatment by March 2025, and the long waits of more than 2 years have fallen slightly. Will that make a difference?
Well, this is a different pathway. This is not about elective care. This is about people who are acutely ill, who need to be admitted to hospital. And there's no other way of getting around it. It is a very specific, different queue. The stuff around electives, I'm sure that's very important, but this is a different problem, and it needs to be given the same sort of priority.
So what would really make a difference, do you think?
First of all, we need to get away from this narrative of despair. This is fixable. It has gone bad very, very quickly. But actually, if we look back at performance graphs, only a couple of years ago, we were in a much better place. So it is fixable, but it requires a lot of political will and managerial will to get this fixed. The first thing to do, and most cost effectively, is to invest heavily in social care. The interface between acute hospitals and social care. People need to get a grip of this, because that is the easiest, quickest, cheapest thing to fix. And it's not easy, but it's very doable.
Thank you very much, Dr. Adrian Boyle from the Royal College of Emergency Medicine.
It is now 7:20.